Hello everyone. Today our lecture will be about the urinalysis. What is that urine test? Urine test, we have the many examination we are do for the sample of the urine. We have to do examination with the microscopically, biochemical test, and then we have that culture test. First of all, the sample to be the correct for the test, we have the collecting of the urine sample in the correct way. The clean container we have and the clean genital area, and also we have the midstream sample. The sample should be collected into that clean container, provided the patient with a clean, dry, and sterile urine collection container. And then we have to give instruction to the patient to clean their genital area with antiseptic wipes to avoid any contamination of the sample, because the genital area sometimes have the another kind of the bacteria. We have to instruction to patient to clean this area before the sample be collected in the container. And also the patient should be collected midstream sample. For the most accurate result, collect the midstream urine sample. It's meaning the middle portion of the sample. They have to avoid the first portion, and then the midstream should be collected. This meaning the patient should start that urination into the toilet and then the stop, and then collected that urine in the container. That's meaning a midstream collecting sample. Then, after the sample is reached to the laboratory and collected into that correct way, we have to do the microscope examination of the urine. We are looking for that urine appearance by the color, transparency, and also we have the odor. That urine appearance, the color is a very helpful to examination and giving indicator to know what the patient have. For example, the color explains the range of the normal color. What is that abnormal color maybe indicate the red, brown, or cloudy, indicating in the blood. While transparency describes what is the cloudy or turbidity of the urine. Cloud signify. And odor explain how the certain odor, for example, we have the sweet, ammonia-like, and also indicate the specific condition. That's helpful to know if there's a patient have any infection or not before we are do the microscope examination. So microscope examination, it is meaning by naked eye we can looking for our urine sample. Then we have the microscope examination. We have here a definition. The examination involved analyzing the small sample of the urine under the microscope to identify the different components presented in the urine. As we know, in the sample of the urine, we have the some component. To know what's the sample present in the urine, we have to do the microscope examination. After we are recorded all the microscope examination in the report, then started to do the microscope examination. Under the microscope, we have the many elements. The key elements that are the typical examination the microscope in the urine sample. We have the some element and the most common one that presented if the patient have infected, such as we have the red blood cell. We say hematuria. Presented of the red blood cell in the urine can indicate a various condition. Maybe the patient have the urinary tract infection, or maybe they have the kidney stone, or we have the bladder infection. In hematuria, we have the two types. Gross hematuria, and also we have the microscope hematuria. Gross, it's meaning you can see the sample by naked eye if there is the color is red or not. It's meaning presented blood in the sample or not. We can find it by naked eye, we can say the gross hematuria. While the microscopic hematuria, it's meaning the urine is clear by naked eye, but the blood cell can be seen when the urine looked at under the microscope or tested in the lab. By naked eye, you can see the sample is clear, but under microscope only you can find it that red blood cell. So we can here say microscopic hematuria. Another element which is very important, we can find it under the microscope in the urine sample if the patient have infected white blood cell. Also another name we can call it pyuria. It's very important to know this term. Pyuria, its meaning presented white blood cell under the microscope. So usually we are not writing prevented white blood cell in our report of the urine. We all call it the sample as a pyuria, meaning white blood cell in the urine. Elevated level of the white blood cell in the urine, it suggests infection of that urine tract. As you see in this picture, it is the white blood cell. Also, we can say there is a pus cell which is engulfed the microorganism, which is maybe the bacteria or any kind of the microorganism, we are call it here a pus. There is a pus cell under the microscope you can see in this picture. What is that epithelial cell? This cell it is a line of the urinary tract. Usually it is anormally presented in the urine. Maybe there is no indicator of any infection or inflammation and it is anormally be presented. But the presented of the certain type of epithelia and the high level of that epithelia it's indicate inflammation or other underlying condition. Mostly we can say if there is presented with a male it is mostly indicator infection than the female because mostly the female presented that epithelial cell in their urine. So we are not usually say there is an infection or there is indicator of the any medical condition, but if there is a high level of that epithelial cell presented in that urine may be indicated the patient have inflammation. Another element that may be presented in the urine which is the cast. The casts are the cylinder structure and they form the renal tube. Urinary cast may be made up of the white blood cell, its meaning regulation of the red blood cell as a cylindrical, or maybe accumulation of that red blood cell, or maybe the white blood cell, or maybe the kidney cell, or substance such as we have the fat or the protein. We have the different kind of the cast, and different type of the cast indicated we have the different kind of the kidney condition. In this indicator we have abnormality kidney condition according the type of the cast. And here very simply we are explaining about the cast as you see in this picture. It is a cylinder in the shape and the accumulation, maybe this accumulation it is the red blood cell, white blood cell, the fat or the protein, and each of the cast of course have the specific name and indicator we have the specific kidney disorder. Crystals. Crystals can be formed in the urine due to various factors. Maybe this crystal presented due to dehydration or the certain medical condition. The type of the crystal can provide information about the patient diet and risk factor for the kidney stone. So we have the different kind of the crystal. So now we are gonna be explaining about this kind of the crystal. Crystalluria. Crystalluria, it is meaning we have presented crystal in the urine. The different kind of the crystal we have. The most common one that found in the urine, we have the uric acid crystal, calcium oxalate crystal. Uric acid, it is meaning hyperuricemia. It's a very important to know if you have hyperuricemia. It is meaning presented uric acid in the urine. What does that indicate? It indicates that urinary tract infection, dehydration, kidney stone, eating a large amount of the certain food including the protein and the salt, fruit and vegetable and medication. Uric acid normally should not be presented and we have the small amount may be presented in the urine. But the high level, it is abnormal condition. This mostly indicates we have the kidney stone of this patient. While the calcium oxalate also it should not be presented. If there is a presented the little bit, it is not be a medical condition. But the high level indicator, maybe we have the dehydration. If the patient have dehydration, maybe you can find the calcium oxalate in the urine. Eating the diet that's too high in the oxalate, protein, salt, and hyperparathyroidism. Because as we know, the parathyroid, which is the main of the function, it is that regulation calcium in the blood. If we have the hyperparathyroidism, it is also indicator we have maybe presented, it's leading to present calcium oxalate in the urine. Inflammatory bowel disease, gastric bypassing surgery for the weight loss, and diabetic and obesity, all these conditions leading to presented calcium oxalate in the urine. This last picture we can find that there is a calcium oxalate, while the first two pictures this indicator that uric acid. The last element that we are talking today about it, bacteria and the yeast. Presence of bacteria is a mostly common we are found in the urine, especially if the sample is collected in the incorrect way. Maybe this bacteria is due to contamination, maybe this bacteria we can find it due to infection. So present of the bacteria or we have the yeast. The yeast here is meaning the fungus, maybe indicator we have that urinary tract infection. So as you see in this picture, the first one is the bacteria as a bacilli. It can find it into that urine, while into that here the second picture we can find it the yeast. This yeast also we can write it down in the report the Monelia. Monelia, it is meaning accumulation, this small kind of the yeast, and found it we can find it in that urine, and also that's indicated for us the patient have that UTI, or we can say that urinary tract infection. Another test for the urine, after we are talking about the macroscope examination, microscope examination, also we have that chemical examination of the urine. What is that chemical examination? Chemical test of that urine also we can now as a urinalysis, involving the analyzing of that urine sample to detect a various substance and abnormality by using the strip reader or the Bayer test automatically machine. Here we have the some chemical component also we can maybe found it into that urine sample. So how can we examination? By the strip that you are found it, see in this picture, we can put it the strip in the urine, and after that we can let it for the 5 minutes and then make examination what is the kind of the chemical component that may be presented in the urine, and of course each kind of that chemically, it is in each kind of the chemical component indicator of the some specific condition. We have the some chemical exam of the urine. pH level. Normal range. Typically, the urine pH ranges from the 4.6 to the 8. Significant pH level indicator the acidic or alkalinity of the urine. Abnormality of the pH level may be suggest a certain health condition or the dietary habits. That's meaning between the alkaline and the acidic, that normal pH of the urine. But if there is a high acidic or the high alkaline, this meaning maybe the patient have abnormality condition due to that certain health condition. That's indicator for us. While the glucose test, normally there should be no glucose in the urine. If there is a presented, what is significant? Presented of the glucose, here is a very important, glucosuria. If I tell you what is that meaning glucosuria, you have to know presented glucose in the urine. That may be indicator the elevated level of the blood sugar level, elevated blood sugar level, which is could be signs of the diabetic. As you know, if the patient have the diabetic, high level of the glucose in the blood may be leading to present glucose also in the urine. We have the some chemical exam of the urine. pH level. Normal range. Typically, the urine pH ranges from the 4.6 to the 8. Significant pH level indicator the acidic or alkalinity of the urine. Abnormality of the pH level may be suggest a certain health condition or the dietary habits. That's meaning between the alkaline and the acidic, that normal pH of the urine. But if there is a high acidic or the high alkaline, this meaning maybe the patient have abnormality condition due to that certain health condition. That's indicator for us. While the glucose test, normally there should be no glucose in the urine. If there is a presented, what is significant? Presented of the glucose, here is a very important, glucosuria. If I tell you what is that meaning glucosuria, you have to know presented glucose in the urine. That may be indicator the elevated level of the blood sugar level, elevated blood sugar level, which is could be signs of the diabetic. As you know, if the patient have the diabetic, high level of the glucose in the blood may be leading to present glucose also in the urine. Bilirubin test. Bilirubin also another component we can find it in the urine. Normally there should be no bilirubin in our urine. When the bilirubin is presented, this indicator maybe the patient have the liver dysfunction or any bile duct obstruction. When the liver is not normally do their function or the physiological is not normal, we can be founded bilirubin, the increasing the level of the bilirubin. When the level of the bilirubin increases in the blood also may be presented and filtered with a kidney and founded into that urine also. So that's indicator for us when the bilirubin presented in this chemical strip, maybe the patient have the liver dysfunction or we have the bile duct obstruction. The final test that we are talking today, which is that urine culture. Actually, when the sample is coming to the microbiology lab, The first test we are do, we have to do the urine culture, and then we are started to do that urine biochemically test, and then we have the microscope examination. The first we have to examination macroscopically, then culturing, then biochemical test, and finally we can do the microscope examination. If there is a urine, send it to the lab for the culture. The urine culture, what does meaning? It is a test that found it and identified the germs, usually bacteria that may be causing the urinary tract infection. Urine in the bladder normally it is sterilized, it doesn't contain any bacteria and other organisms such as we have the fungus, bacteria in the urethra can be causing infection. Its meaning our urine it is sterilized. There is no microorganism presented. If any microorganism presented, it is directly indicator we have the infection. The urine specimen is kept under the condition that allowed bacteria and other organisms to grow. If the few or no organism grows, the test is a negative. If the organism grow, the number the large enough into indicator an infection, and culture is a positive. It is meaning after that urine come to that laboratory and you are started to culturing, we have to know if there is in the sample presented bacteria or not. If there is grow, we are make the environment it is available or make the environment is a good environment to bacteria big growth. When they allow this environment to bacteria big growth and there is no growth for the bacteria, it is meaning there is a negative. And if the bacteria grow under the favorability condition, we can say there is meaning a positive or the sample have the bacteria or presented the different kind of the bacteria in this sample. Why we are using of the urine culture? The urine culture, it is important to know what is the cause of that urinary tract infection. As we know, we make examination directly under a microscope and maybe we find the bacteria, but we don't know what is the kind of the bacteria, what is the main cause. We know the patient have infection, but we don't know what is the cause of this infection. So because of that, to know the cause of that UTI, we have to culture. And also another important things, the second things we have to make a decision about the best treatment. It's a very important to choose the best treatment and the best antibiotic to the patient, and this is called a sensitivity test. A urine culture may be done when abnormality results from that urinalysis. When that urine culture done and abnormality result of that urinalysis, such as we have increasing number of the white blood cell, show the signs of the infection. That's another uses for the culturing of the urine.